For many people, when you're not feeling quite right, instead of calling your practitioner, you're turning to the internet to search down all those solutions. Well, today, we want to get your pressing health questions addressed from the comfort of your home. Bunny slippers on your feet, up on the couch. Today, we're tackling real questions from real viewers, and the doctor is in the house. Please welcome Associate Medical Director of Doctor on Demand, Dr. Kristin Dean in San Diego, California. Welcome, Dr. Dean.
Hi, good morning.
Okay, Dr. Dean, our first question is from Talaya, and she, like a lot of people, she has COVID concerns on her mind. Let's take a look.
Hi, my name is Talaya from New Jersey, and I would like to ask, is sinus pain or nasal pressure a symptom of COVID-19?
You know, Dr. Dean, it treads a really fine line, and it's a concern that many people are wrestling with. How do you tell, what's this, what's that? What's your recommendation?
Usually when people have sinus pain, it is because they have congestion or a runny nose. And although the sinus pain itself is not necessarily a symptom of COVID-19, congestion or a runny nose both can be due to COVID-19. So it's helpful to consider who you've been around for the 14 days before your symptoms started. Were you around anyone who had COVID-19, or were you in an area where COVID-19 has a high infection rate at the time? Some people might have allergies during this time of year, and they always get a sinus infection with their allergies.
Sure.
So for that person, if they weren't around anyone with COVID and they started to develop their usual allergy symptoms and then started having sinus pain, you would think that that might be more likely to be explained by their run-of-the-mill sinus infection than by COVID-19.
Sure. And I think this is one of those cases where consulting your doctor, calling your doctor, it doesn't hurt. I mean, I'd rather be safe than sorry. What kind of treatments do you recommend, and when do you say, hey, it's time for antibiotics?
I typically recommend home remedies at first. For example, a nasal saline rinse can be really helpful to flush out some of the mucus and debris that gets trapped in your sinuses and actually causes that sinus pain. I also typically recommend a nasal steroid spray. And of course, like many other illnesses, just some good old-fashioned rest can help your immune system fight off the infection.
That's right. I'm a big fan of rest. There's no doubt about it. We got another question. Let's hear what that question is.
Hi, my name is Jenny from Jersey City, New Jersey. And I want to know, do cranberries or cranberry juice actually help with UTIs?
Can cranberries cure UTI? And I'm going to add to that question. If they can't cure it, can they help prevent a UTI?
Generally speaking, there isn't a ton of science to back up the idea that cranberries can help with urinary tract infections. Some smaller studies did show that it possibly could help prevent the infection, but when it was looked at it in larger reviews, it didn't necessarily show any big improvements. So I don't recommend anyone start drinking cranberry juice to correct a urinary tract infection once they already have symptoms. UTIs are caused by bacteria that naturally occur in our gut. So once they've been introduced to the urinary tract and you've developed those infection symptoms, then it's really too late to try and prevent it. And of course, antibiotics are the only known treatment that we have for urinary tract infection. So it's really important to get started early to prevent it from going up into your kidneys, for example, and developing a worse infection.
I appreciate all your good information, Dr. Dean. Thanks for joining us.
Yes, thank you.
All right. And if you at home have health questions you want answered, guess what? You're in luck. There's an app that can help you. Our executive producer, Jay McGraw, created Doctor on Demand. You see it on the screen. It offers live video visits with board-certified physicians and mental health professionals 24 hours a day, 7 days a week, 365 days a year. They can actually also send you new prescriptions and prescription refills to your local pharmacy in just a matter of minutes. It's simple to register for an account and to connect with a doctor using your smartphone, your tablet, even your computer. To learn more, go to our website, drstv.com.